Hi, my name is Nick Cleland. I'm one of the surgical specialists here at Veterinary Specialist Services. Today we're going to have a chat about organ biopsy. So when your pet comes into the hospital due to their condition, one of the veterinarians here may recommend that they have a biopsy of one of the organs within the abdominal cavity. So typically there are two ways in which we can do that. We can do it via an open approach, which would be traditional surgery, or we can take a more minimally invasive approach, which has several advantages, including decreased pain, potentially decreased hospitalisation, and they can certainly be more comfortable in the post-operative period. So multiple organs within the abdominal cavity can be approached with a minimally invasive approach, also known as laparoscopy, including the gastrointestinal tract, lymph nodes, the pancreas. Probably the most common organ that we biopsy with a laparoscopic approach is the liver. One of the advantages of taking a biopsy over, for example, a fine needle aspirate of an organ is that the pathologist can look at the tissue architecture, and sometimes we can get enough tissue to send off for specific tests. For example, with the liver, we'll often send off for copper analysis. So laparoscopic biopsies can often be a day procedure. Depending on the wellness of your pet and how they wake up, sometimes they will need to stay in hospital for a little bit longer. Typically they'll be admitted in the morning by one of our surgical nurses, or you may have a face-to-face discussion with one of the surgeons here prior to the procedure. So there are different techniques for access to the abdomen with laparoscopy. Sometimes we will make a single incision, which is approximately 2.5 to 3 centimetres long, where we can place our camera and instruments all through the same port. Or we can sometimes use multiple incisions, so we have different ports of access. Your pet will often be discharged with a light dressing covering the wound or wounds, and they can stay on for several days after surgery, but shouldn't be left on for much longer than 2 to 3 days. If they fall off after they get home, they don't need to be replaced. If they're showing too much interest in that wound, they'll need to have a cone applied to stop them from licking it. After the biopsies are taken, they're sent to the laboratory, and depending on which tests are organised, they can take anywhere from 3 to 5 business days, or for some tests a little bit longer. Once those results come back, we can be on the road to having a more directed and appropriate treatment plan for your pet. Complications are relatively rare with laparoscopy, but if you have any further questions about the procedure or the associated costs, please don't hesitate to give us a call at Veterinary Specialist Services.